I want to tell you about a man named Harold, 74 years old, retired civil engineer. Precise man. The kind of person who maintained his lawn with a level, kept a logbook of his blood pressure readings, and had not missed a single annual checkup in 22 years. Harold considered himself informed, prepared, in control of his health. And on an ordinary Tuesday morning, Harold walked into his bathroom, sat down, and strained slightly while using the toilet. It was something he had done 1,000 times before. A completely normal morning routine, something he had never once given a second thought. He never made it to breakfast. His wife found him on the bathroom floor 12 minutes later. Harold had suffered a hemorrhagic stroke. That means a burst blood vessel in the brain, so severe that it took him 11 months of rehabilitation to regain partial use of his left hand. He never fully recovered. When I reviewed Harold's medical history in the weeks after, I found something that stopped me cold. His blood pressure, measured routinely at every checkup, had been well controlled. His cholesterol was managed. His lifestyle was careful. What nobody had ever told Harold, not one of his 22 years of annual physicians, was that the bathroom contains a specific set of physiological triggers that, for a person over 60, can send blood pressure into a dangerous spike within seconds. Triggers that turn an ordinary morning routine into a cardiovascular event. This is not rare. In fact, the bathroom is one of the most common locations for strokes and cardiac events in adults over 65. And almost nobody talks about it. Stay with me, because what I'm about to share changed how I think about bathroom-related cardiovascular risk, and it might change everything for you too. I'm Dr. Soren. I'm a cardiothoracic surgeon with 28 years in the operating room. I have performed over 2,500 open-heart surgeries, and I have seen, more times than I can count, the devastating aftermath of cardiovascular events that began in the bathroom, a room where the body is placed under sudden, repeated physiological stress in ways most people never consider. I make these videos because the conversation I'm about to have with you is the one I wish I could have with every patient before they reach my operating table. Most doctors don't have time to ask about bathroom habits. I am going to ask now, and what I share may be the most important 4 minutes of reading you do this year. Here is what you must understand about blood pressure and the aging body. After 60, your vascular system loses what cardiologists call auto-regulation. That means the ability of your blood vessels to smoothly and rapidly adjust to sudden changes in pressure. In a younger person, when blood pressure spikes sharply, the arterial walls flex. They absorb the surge. They adapt within seconds. After 60, those walls are stiffer, less elastic. The spike arrives, and instead of being absorbed, it is transmitted directly through the system. Think of it like old copper pipes in a house. New pipes flex under a sudden pressure surge. Old pipes hold rigid, and when the pressure is sharp enough and the pipe is brittle enough, something gives way. Studies show that adults over 65 experience blood pressure spikes that are 40% sharper and last 60% longer in response to the same physical triggers compared to adults under 50. The same trigger, a bigger, longer spike, in a system with less capacity to absorb it. The advice designed for someone at 45, don't strain too hard, skips entirely over the specific multiple compounding ways the bathroom creates pressure crises in an aging cardiovascular system. That distinction, and what to do about it, is exactly what we're covering today. Number 1. Straining during a bowel movement. Here's what nobody tells you about what happens inside your body when you strain. The moment you hold your breath and bear down, even mildly, you trigger what is called the Valsalva maneuver. That means you are forcibly increasing the pressure inside your chest and abdomen by closing off your airway and pushing. This action compresses the large veins, returning blood to the heart. For a brief moment, blood return drops. Then the moment you release, that blood floods back in a sudden surge. Blood pressure spikes sharply, sometimes 40 to 50 points above baseline, in a matter of seconds. For a younger person with flexible arteries, that spike is managed quickly. For a person over 65 with stiffened arterial walls and any degree of existing hypertension, that spike is a loaded gun. I have seen this with my own eyes. Patients whose strokes or cardiac events were preceded by a bowel movement that morning, documented in their records, noticed by nobody. A study published in the American Journal of Cardiology found that the Valsalva maneuver during straining produced peak systolic blood pressure, the top number, increases of an average of 54 points in adults over 65. That is the equivalent of a person with controlled blood pressure of 125, temporarily hitting 179 in seconds. The fix is specific and immediate. First, address the root cause. Take 1 tablespoon of ground psyllium husk mixed in 300 ml of water each morning. This provides sufficient soluble fiber to eliminate straining for the vast majority of people within 5 to 7 days. Second, while seated, lean forward slightly with your forearms resting on your thighs and your feet raised on a small step or folded towel. This position, called the squatting angle, relaxes the puborectalis muscle and allows passage without straining at all. Do not hold your breath. Breathe steadily throughout. These two changes together eliminate the most dangerous bathroom trigger almost entirely. Number 2, standing up too quickly from the toilet. Let me ask you something. How quickly do you stand up after using the toilet? Most people give this no thought at all. You finish, you stand. Natural, automatic, done in one motion. Here is what is actually happening. When you sit on the toilet, blood pools in your lower body, legs, pelvis, abdomen. When you stand up quickly, gravity pulls that blood downward. Your heart must work rapidly to compensate, pumping harder to push blood back up to your brain. At the same time, your blood vessels need to constrict quickly to maintain pressure. After 60, that compensatory response is slower, less reliable. The medical term is orthostatic hypotension. That means a sudden drop in blood pressure upon standing. It causes a brief but significant reduction in blood flow to the brain. Most people experience this as a momentary dizziness or darkening of vision. But in someone with arterial stiffness or any pre-existing cardiac condition, that drop followed by the compensatory spike creates a dangerous pressure whiplash inside cerebral blood vessels. That whiplash is a direct stroke trigger. Research published in the Journal of the American Geriatric Society found that adults over 65 who experienced orthostatic hypotension upon standing, even mild unreported episodes, had a 40% higher incidence of cerebrovascular events. That means strokes and transient ischemic attacks over a 5-year follow-up period. The fix: after using the toilet, sit upright for a full 30 seconds before standing. Then rise slowly, using one hand on a wall or grab bar for support. Stand still for 10 full seconds before walking. This 30-second pause allows your vascular system to begin adjusting before gravity takes over. It feels unnecessary. It is not. It is the difference between a managed transition and a pressure crisis. Have you ever stood up in the bathroom and felt a sudden dizziness or rush to your head, even briefly? Write it in the comments. I read every single one. Number 3, hot showers, especially first thing in the morning. Here's what surprises most of my patients when I explain this. A hot shower feels relaxing, soothing, good for the body, and for most of your life, it was fine. But here is what the brochure doesn't show you. A hot shower causes rapid vasodilation. That means your blood vessels suddenly widen throughout your body in response to the heat. Blood rushes toward the skin surface. Blood pressure drops. Your heart accelerates to compensate. In the first minutes of a hot shower, particularly first thing in the morning when your cortisol is already surging and your blood pressure is naturally elevated, your cardiovascular system is managing two powerful and opposing forces simultaneously. For a person over 65, whose arterial walls cannot adjust fluidly to rapid pressure changes, that combination, the morning cortisol spike plus the heat-induced vasodilation, creates a window of extreme instability. Some patients go pale, some feel faint, some simply collapse, and some, with underlying arterial fragility, experience a cerebrovascular event in the shower stall. Earlier in my career, I never thought to ask patients about their shower temperature. It seemed trivial. Then I began tracking the timestamps on emergency admissions in my hospital, and I noticed a pattern in morning bathroom events that made me start asking. I have asked ever since. A study published in Hypertension Research found that adults over 65 who took hot showers above 40 degrees Celsius, that is 104 degrees Fahrenheit, in the morning had systolic blood pressure fluctuations averaging 31 points within the first 3 minutes compared to those who shower at warm but not hot temperatures. The fix is precise. Set your shower temperature to warm, comfortable but not steaming. If you use a temperature dial, this means roughly 37 to 38 degrees Celsius. Before entering the shower, run cool water over your wrists and lower arms for 15 seconds. This pre-acclimates your peripheral circulation and reduces the shock of the temperature transition. Never step directly into a hot stream. And if you feel any dizziness, lightheadedness, or unusual warmth in your face, step out immediately and sit down. A shower is not worth a stroke. Number 4, using the bathroom immediately after waking without drinking water first. Here's what the standard advice gets completely wrong about the first 5 minutes of your morning. You have been asleep for 7 or 8 hours. You have not consumed any fluid. Your blood is at its thickest, most viscous of the entire day. And the first thing your body does when you wake is trigger a natural morning cortisol surge that raises your blood pressure sharply. Now add the act of using the bathroom, even without straining. The simple act of getting up, walking, sitting, and the mild bearing down involved in urination engages your abdominal muscles and briefly elevates intra-abdominal pressure. That means pressure inside the belly, which in turn can push blood pressure higher. You are stacking 3 cardiovascular stressors in the first 5 minutes of consciousness: thick blood, elevated cortisol, and bathroom exertion. The medical term for thickened blood in the morning is increased hematic viscosity. That means the blood moves more like syrup than water, making clots far more likely to form, and arterial walls far more likely to be damaged by the pressure surge. What would I recommend for my own parent? Keep a 300 ml glass of water on the nightstand. Drink it before your feet touch the floor, before the bathroom, before anything else. That single habit thins your blood, gently lowers the cortisol spike, and prepares your vascular system for the exertion that follows. Studies published in the Clinical and Experimental Hypertension Journal show that drinking 300 ml of water upon waking reduces morning systolic blood pressure by an average of 9 points within 30 minutes. 9 points from a glass of water. Before the bathroom. Number 5. Spending too long in the bathroom, especially on your phone. Here's what nobody tells you about sitting on the toilet for extended periods. It has become remarkably common. You bring your phone, you scroll. 5 minutes becomes 15. 15 becomes 20. It feels harmless. It is not. When you sit on a toilet seat for an extended period, the seat rim creates direct pressure on the perineal nerves and blood vessels. That means the vessels and nerves in the lower pelvis. This pressure, sustained for more than 5 to 7 minutes, begins to restrict venous return from the lower body, the flow of blood back upward toward the heart. The longer you sit, the more blood pools. When you finally stand, the redistribution is sudden and large, creating a more severe orthostatic pressure drop than if you had stood up after 2 minutes. Additionally, the mental stimulation of phone use, notifications, news, social media, triggers that secondary cortisol response we discussed in your morning vulnerability window. You are combining pooled blood, extended positioning, and stress hormone activation, and then you are asking your aging vascular system to manage all of it simultaneously when you finally stand up. Research published in the Journal of the Royal Society of Medicine found that adults who regularly spent more than 10 minutes per bathroom visit had significantly higher rates of hemorrhoidal disease, but more relevant to our discussion today, also showed measurably elevated post-sitting blood pressure surges compared to those spending under 5 minutes. The fix: leave your phone outside the bathroom. Completely. Every time, set a soft rule: no bathroom visit longer than 5 minutes. Keep a small stool or folded towel to elevate your feet slightly while seated. This reduces pelvic pressure and improves venous return naturally. And stand up slowly, using the wall or grab bar every single time. I want to tell you about Evelyn, 78 years old, retired pharmacist, meticulous woman. She had managed her blood pressure for 11 years with the same medication, the same dose, and never a reading that concerned her cardiologist. 2 different physicians in the past 3 years had called her cardiovascular profile stable. Evelyn came to me not after a stroke. She was fortunate, but after a transient ischemic attack, ATIA, a warning stroke that lasted 8 minutes and left her with temporary confusion and a fear she described to me as the worst 8 minutes of my 78 years. I sat with Evelyn for 40 minutes, not 7. 40. I asked her to walk me through her morning, in precise detail, the way a pharmacist would describe a medication protocol. And she did exactly that. She woke each morning and went immediately to the bathroom. No water first. She took a long, hot shower. Very hot, she said. I have always preferred it that way. She sometimes strained during her bowel movement because, in her words, things have slowed down as I've gotten older and I just wait for it to happen. She brought her tablet into the bathroom most mornings and read the news while seated. And she stood up quickly afterward. I'm not an invalid, she said, with a small smile. 5 bathroom behaviors. All of them ordinary, none of them ever discussed with a physician. Together they were, every single morning, subjecting Evelyn's 78-year-old arterial system to a cascading series of pressure events before she had eaten her first meal. We addressed each one: the water first, the shower temperature, the psyllium husk and footstool, the phone removed from the bathroom, the slow, careful standing. Every change was specific. None of it was complicated. 8 weeks later, Evelyn's morning blood pressure readings, which she tracked faithfully in a logbook, had dropped an average of 17 points at their peak. She had not had another TIA. Her cardiologist, reviewing her logbook, called the improvement remarkable and asked what had changed. She told him about our conversation. He called my office that afternoon. He said he had never thought to ask his patients about the bathroom. Neither had I once. I ask now. Every time. Because Evelyn taught me something that 11 months of Harold's rehabilitation had already been trying to tell me. The most dangerous room in the house is not the one with the stairs. It is the one where we believe nothing can go wrong. Let me bring this together for you clearly. 1. Take 1 tablespoon of ground psyllium husk in 300 ml of water each morning and use the squatting angle with your feet raised. Eliminate straining completely. 2. Sit on the toilet for 30 full seconds before standing, then rise slowly with support and hold still for 10 seconds before walking. 3. Set your shower temperature to warm, not hot, and run cool water over your wrist for 15 seconds before stepping in. 4. Keep a 300 ml glass of water on your nightstand and drink it before your feet touch the floor, before the bathroom, every single morning. 5. Leave your phone outside the bathroom. Keep every visit under 5 minutes and use a small footstool to reduce pelvic pressure while seated. Start tonight with the simplest action. Fill a glass of water and place it on your nightstand right now. Tomorrow morning, that glass goes into your body before anything else. Before the bathroom, before the shower, before the coffee. That one glass. Tomorrow morning. Everything starts there. Your body has been working for you every single minute of your life. Give it what it needs. It will respond. If this video gave you something real, share it with someone you love. A spouse, a sibling, a friend over 60 who has never once thought about what happens inside their body during those first 10 minutes in the bathroom every morning. That one share might be the most important thing you do today. And tell me in the comments, which of these 5 hit closest to home? Was it the straining? The hot shower you have taken for decades? The phone you bring in every single morning? I genuinely want to know. Everything I've shared today is general medical information based on published research and my clinical experience as a cardiothoracic surgeon. It is not a replacement for your personal medical care. Every person's situation is unique. Before making any changes, especially to medications or supplements, please have a full, honest conversation with your own doctor. That conversation, informed and unhurried, is exactly where good medicine begins.